So we're looking at the epicranial muscles. They are highlighted, and the front portion right here, these are going to be the frontal belly, okay? And they are then going to connect back with what we call the epicranial aponeurosis, which is going to be a tendon that is going to then connect to these muscles. These muscles are going to be important in facial movements, specifically in raising of the eyebrows. Our next muscles are going to be the Buccinator oculi muscles, which surround the eyes. They are going to be involved in closing the eyelids, and the origin is going to be on the frontal and maxillary bones, and the insertion is going to be on the tissues of the eyelids. Our next muscle is the Buccinator, and you can actually see it highlighted, but it's going to be a muscle that's deep, so we have to remove some of the outside layers. So here we have the Buccinator, and it is going to originate on the maxilla and mandible, and it's going to insert on the Orbicularis oris. Okay. It is going to be involved in compressing the cheeks inward, whistling, and sucking. We now have the Zygomaticus. The muscle is going to originate on the zygomatic bone right here and is going to insert on the skin and muscle at the corner of the mouth. It is going to be involved in raising the corners of the mouth during smiling. We now have the Orbicularis oris, which are going to be the muscles that are surrounding the mouth. They are going to have origins on the maxilla and the mandible and are going to insert on the skin and muscle around the mouth. They will be involved in closing and puckering of the lips. We now have the temporalis muscle. This muscle is going to insert on the mandible, and it's going to originate on, you guessed it, the temporal bone. It is going to be important in closing the jaw and elevating and retracting the mandible. So this is going to be retraction. And here we have mandible elevation. Now we're looking at the Masseter muscle. This muscle is going to originate on the zygomatic bone and is going to insert on the mandible via the ramus. It is going to close the jaw and elevate the mandible. Here it is isolated. And now we'll look at the motions. So we have elevation of the mandible. So this is going to also work with the temporalis. So our next muscle is going to be the Sternocleidomastoid. I'm actually going to remove the platysma so that we can see this muscle a little bit better. So hiding that. And so this is the Sternocleidomastoid. It is going to originate on the sternum and the clavicle, okay, and it is going to insert on the temporal bone. This muscle is going to be involved in rotating the head and flexing the head, and I will show you those motions on the next slide. So here we have the head rotation, and what you're going to see is that whatever muscle is actually doing the contraction is on the opposite side of the direction the head is turning and rotating. Okay, Okay, so only one muscle, one of the sternocleidomastoids, will be activated at one time while we're actually rotating the head. Here we have flexion of the head, and in this case you can see that both of the sternocleidomastoids are actually being used, not just the one.